On February 25, 1990, a tragic event occurred when a woman named Terry Schiavo suffered from a sudden cardiac arrest attack. This is most likely due to a chemical imbalance in her body. During that time, her brain was unable to receive oxygen for a total of 5 minutes, resulting in irreversible brain damage and Terry being in a persistent vegetative state. Terry's body now couldn't live without being connected to a feeding tube, and with the brain damage, it was likely she wouldn't ever wake up again. With no hope of recovery, Terry's husband filed a petition to have the feeding tube removed so that she could die naturally, because he believed that that is what she would have wanted. But her parents were very against it because they believed that she still had a chance to recover. Physician-assisted suicide is when a terminally ill patient meets the requirements to qualify for assisted suicide and is prescribed a lethal medication so that they may be able to end their life. Euthanasia is when the physician acts directly in ending the patient's life, such as injecting a sedative or lethal drug into the patient. Physician-assisted suicide is illegal in 45 states of the United States, while euthanasia is illegal in all of them, even if it is with consent. When a patient is facing inevitable death, we should respect the right of the individual to make an important decision of their life. Having laws in place that take away that decision is both immoral and cruel. Most of the arguments made against this topic are false claims. As of now, physician-assisted suicide is only legal in California, Oregon, Colorado, Vermont, and Washington. The people who oppose physician-assisted suicide fear that the legalization of this leaves patients vulnerable to pressure to end their lives, not only from insurance providers, but from family members too. As said in the article, physician-assisted suicide in Hawaii is an attack on all of us. Those who protest also claim that if we were to pass this law, that we fail to empathize with those who are suffering and are devaluing human life. But that is not true. I don't think that it's morally right to force people to live when they are suffering. People who have to experience chronic pain every day with no hope for a cure have to experience that pain with no escape. Researchers in 2006 estimated that 5 to 14% of chronic pain sufferers commit suicide, and 20% engage in suicidal thoughts. According to the article, Assisted Suicide, chronic pain sufferers are at least 2 times as likely to commit suicide than non-sufferers. Contemporary palliative medicine is used for relieving as much pain as possible while the patient's days are numbered. Even though palliative medicine works most of the time, it isn't guaranteed that the pain will entirely go away. In fact, the article, Physician-Assisted Dying is Justified by Accepted Ethical Principles, states that some patients will continue to experience unbearable physical symptoms or psychological distress despite the best that palliative care can offer. Forcing terminally ill patients to suffer until the day that they die isn't the morally right thing to do. Now, it isn't that I believe terminally ill patients should all end their life early. It should be for those who are suffering most and are ready, spiritually and mentally, to move on. Physician-assisted suicide isn't as evil as people think. Before anything happens, you first would have to meet the requirements. According to California's Right to Die law is working, assisted suicide laws require that the patient have the physical ability to self-administer the medication and have the mental competence to make an extraordinarily difficult decision. In addition to the requirements, it is stated in the Columbia District and the other states that have it legalized that the patient must be at least 18 years of age, a legal resident of the state or district, of sound mind, and diagnosed with a terminal illness that is deemed likely by doctors to lead to death within 6 months. Laws require that at least 2 physicians verify the patient's eligibility too. Knowing that all patients are likely to pass away within 6 months, it should be seen as the right to take control of your own death. Offering physician-assisted dying is a way to show compassion to our citizens. Brittany Mayard is a prime example. She was a 29-year-old California woman who, in 2014, moved to Oregon with her family so that she could use Oregon's Death with Dignity law to escape the final, brutal days of end-stage brain cancer. We should respect the decisions of all those who have already endured so much pain. and we should have their choice protected under the Death with Dignity law. Those who are against physician-assisted suicide commonly claim that if we legalize this, it will lead to the legalization of euthanasia, eventually slide down what they call a slippery slope. But there is no evidence for that. In fact, the Dutch have had both euthanasia and physician-assisted suicide legalized since 1995, and no such slope has formed. There's constant talk about the depressed, mentally ill, mentally incompetent, those who can't consent, the disabled, and elderly patients being pressured by their own families and to be relieved of the burden of their care. The article, "There is no evidence that legalizing euthanasia will lead to a slippery slope," references a 2009 summary of research by Dutch scientists that conclude that there is no evidence for a higher frequency of euthanasia among elderly, people with low educational status, the poor, the physically disabled, or the chronically ill, minors, people with psychiatric illnesses including depression, or racial and ethnic minorities compared to the background population. This research shows that the slippery slope doesn't exist. In fact, the majority of the lives ended through euthanasia were patients who were expected to live only for more or less about a week. It is immoral to force somebody to suffer through the last days of their life. The opposing side argues with false claims and manipulates their words to make euthanasia sound immoral. And in reality, it is an act of mercy.